Afternoon is Randy Chapman. I'm the Director of State Relations at CAQH, and it's a pleasure to have you all on today to discuss essential keys to managing coordination of benefits during a crisis. We are all sort of dealing with the fallout from the current health situation, the current pandemic, in our own ways. But I think coordination of benefits is one of those things that really needs some special attention and has some issues where we can really make some positive moves to help Medicaid plans in particular. So we're going to talk a bit about that today. So thank you again for joining. And next slide. Just a few housekeeping pieces. Today's session is being recorded, of course. So if you all have registered, you will receive a link to the recording after the webinar. All the phones will be muted during the webinar. If you have a question throughout the session, please do not hesitate to put your question into the chat box. We will have a question and answer session at the end of the webinar, but as you know, as you go throughout, you've got questions. I want to make sure that you capture those so we can get to them at the end. So please do that. If you look at the panel on the right side of the go-to webinar desktop, you'll see a little section that says questions. So you can just pop your questions right in there. Next slide. So let's just dive right in. First, I want to tell everyone a little bit about CAQH. Actually, I should say first, I want to thank the Florida Association of Health Plans, Laura and the staff there have been really helpful in partnering with us on this webinar and providing this opportunity to bring you this information. So thank you very much to the Florida Association of Health Plans. And also thanks, of course, to my colleagues at CAQH. So as we look at the ongoing need to reduce healthcare costs, especially as they pertain to administrative expenses, while also trying to balance the increasing information that's coming in with regard to healthcare, the information accuracy is really at the heart of what we do at CAQH. In concert with a wide range of healthcare stakeholders, CAQH develops and implements shared industry-wide initiatives that eliminate long-term business inefficiencies and produce meaningful concrete benefits for healthcare providers, for health plans, and for patients. CAQH initiatives are fundamentally changing the direction of healthcare. And we are redefining how the industry does business today and in the future. Next slide. So we're really excited today to be working in partnership with United Healthcare for this webinar. United Healthcare is working to create a system that is connected, aligned, and more affordable for all involved. That system should be one that delivers high quality care, is responsive to the needs of each person and the communities in which they live. Where they are also, United is also partnering with care providers, collaborating in new ways to improve patient care. United is working to play a part in creating a more sustainable healthcare system, one that works better for everyone. As we all know, these are extraordinary times in healthcare, and the opportunities to help people live healthier have never been greater. With advanced data and technologies, breakthrough treatments, and consumer choice, all of those things are redefining what can be achieved in healthcare, and United is on the forefront of that. So thank you again for joining us today. Next slide. So our presenters.
Hi, Randy. Sorry, this is Maggie. I'm getting complaints that some people can't hear. Can people just write in the question box if they can hear us? Give us a yes or, well, obviously a yes, because if you can't hear us, then we'd get no's. Sorry to interrupt. Okay, it looks like we are getting, people can hear okay that are on the webinar.
Okay.
Okay, I just wanted to double check. All right, thank you, Randy. Sorry about that.
No, I appreciate that. It doesn't do any good if people can't hear it. So I appreciate that, and please certainly let us know if you're having trouble hearing. So just want to go over our speaker bios for today. We are pleased to have Tiffany Sees from United Healthcare and Morgan Tackett from CAQH joining us as presenters. Tiffany Sees is an associate director for payment integrity at United Healthcare. She's been with the company for approximately 13 years. Tiffany's healthcare background includes claims operations, quality and remediation, project management, payment integrity, and coordination of benefits. Tiffany is currently focused on oversight for payment integrity and coordination of benefits, COB, with United. My colleague Morgan is a group product manager at CAQH. In this capacity, he leads the development of solutions that assist health plans, healthcare providers, and other industry officials to simplify the administration of healthcare operations practices. Prior to joining CAQH, Morgan spent over 20 years in leadership positions in academic hospitals, physician practices, and at Blue Cross and Blue Shield of North Carolina. So again, thank you, Tiffany and Morgan, for joining us and presenting today. And now I'm going to turn it over to Morgan for the presentation. Thank you.
Okay, thank you, Randy. On the next slide,
I apologize, Morgan. That was my mistake. We had an agenda, but we'll go ahead and let you go on and get started.
Okay, great. So hi everybody, Morgan Tackett here. I'm glad to be with you today. I just wanted to start by saying I think we could all agree that challenges with the current industry coordination of benefits processes are numerous. First of all, it's difficult to share information across payers, and what information is shared is usually done retrospectively and manually, both of which can drive up the cost of COB processes to the payer. And second, every health plan has a different way of doing things. So when those manual inquiries do happen, they generally take longer to accomplish as a result of there being no common language that health plans speak regarding coordination of benefits. And third, the data that is shared may be of a differential content and quality, especially if it's not current, which is often the case when COB data is only updated once a year from a patient survey, or if it's gleaned from an inbound claim from a provider that contains other coverage information. So on the next slide, CAQH recognizes that the absence of complete and timely information about all the coverage that a health plan member carries can be a driver of cost as well, through errors, delays, and associated rework that occurs when a payment is made by the wrong payer or in the wrong order to a healthcare provider. And these inefficiencies in COB research, investigation, and resolution span the life cycle of the patient encounter that you can see here, all the way from the patient registering to see a provider, receiving care, a claim being generated and submitted and paid, and then any follow-up activities regarding that payment, including a member appeal. So if providers don't have the correct information on their patient's coverage before any of these activities start, claims can then be filed to the wrong payer in the wrong order, which eventually results in the need to re-adjudicate the claim, request recoveries or refunds from providers and patients, manage communications, and then trade information back and forth between the provider and the payer, or the patient and the provider. So many of these expenses can be avoided through the transparent and secure sharing of common patient coverage information. So we're going to talk a little bit about what that best practice looks like here on the next slide. And you'll just bear with me if we just walk through these, not across the page, but by the number in the blue buttons here. First of all, we think a best practice scenario includes health plans submitting enrollment information and sharing enrollment information to other payers on a regular basis. Then having a system that can take that common coverage database match member information, determine primacy of member information. Once an overlap or a COB instance has been identified and primacy has been determined, then going back to both of those payers involved in that overlap, and then determining that those overlaps are still currently active, then having a common format for reporting those coverage overlaps and the confirmed primacy and the confirmed current coverage status back to those participating health plans, again on a regular basis. And then having the payer have some kind of integration with their back-end system so that this information can easily be absorbed as close as possible to the point that that member is enrolled in the payer. And then having that member record set up in a way that claims can be paid correctly and in the right order. So just in summary, a process that allows for analyzing shared data amongst health plans, a process to confirm the current active coverage status of members when overlaps are identified, and then a consistent production of reporting that allows the health plans to consume data with the least amount of manual intervention or review as possible. So we're going to come back to this best practice scenario in just a second, but I'd like to take a few minutes to talk about what we're seeing at CAQH in terms of the impacts specifically of the current COVID-19 healthcare crisis on COB operations. So if we can just flip forward to the next section. On this next slide, according to the Center of Budget and Policy Priorities, millions of Americans have lost their jobs or experienced sharp income losses due to the COVID-19 and its subsequent economic recession impacts. And you've seen this in the news. We're looking at the job loss and job gain information on a monthly basis. And our data here at CAQH shows that between February and July of this year, we've seen in our own population about a 9% increase in Medicaid enrollments in the COB data that we collect and share here at CAQH. And this is confirmed by second quarter financial statements from some of the major health insurance providers that participate and work with CAQH amongst their own Medicaid enrollees. And most of these participants, these payers, also confirm that they've seen, as they've seen Medicaid populations grow, they've seen corresponding changes to commercial coverage in their own organizations, and seeing and projecting that these changes and shifts in membership will continue throughout the end of the year. Then on the next slide, we've got some information from the Better Medicare Alliance, which shows shifts specifically in the state of Florida in terms of Medicare, fee-for-service, and Medicare Advantage populations. Now, I'll point out at this point that at CAQH, we deal with all types of commercial coverages, including individual, both self-funded and exchange, group coverage, both insured and ASO, managed Medicare, and managed Medicaid. And on the next slide, we are showing some changes that we've seen in the state of Florida, specifically in our membership population in our database since the beginning of January through the beginning of September. And certainly we think that COVID has changed many aspects of the traditional COB and payment integrity program operations, and we can see this in our data here at CAQH. First of all, the balance of activity between recovery and prevention has certainly been disrupted. There's been more focus by health plans on the aspects of prevention as recovery processes have been redirected or disallowed during this crisis. We've seen a shifting membership change as job losses and associated healthcare coverage losses evolve. And we're seeing a migration of coverage from group insured to individual, exchange, or Medicaid coverage, and also a growth in Medicare Advantage populations as furloughed workers are choosing early retirement, or already retired individuals are looking for cost savings by pursuing a managed product as opposed to a fee-for-service product. So we track this information on a weekly basis, and we continue to see shifts not only in the state of Florida, but also in our total population. So when we think about how we manage through these times, as we manage through the changes that and processes within health plans, the shifting populations within health plans, and those membership changes, we're advocating for a prospective approach to COB, and that's been our position for the last 7 years that we've been involved in coordination of benefits work with the industry. And we think that some of the requirements that should be set for what an efficient industry-wide COB solution looks like is that the solution should be able to easily determine primary and secondary payers for the payment of healthcare claims through system integration and automation. The solution should have data that's managed and reported through a neutral third-party source, and CAQH is that neutral third-party source looking to provide that information to the industry. The solution should inform providers of overlapping coverage and the correct order of benefits before care is ever delivered. So not looking at COB as something that needs to be corrected after an action's taken, but something that needs to be identified and prevented before claims are paid. A solution should frequently update information and communicate it to the industry. We think the most reasonable cadence for that, given the changing nature of membership information and enrollment conditions within health plans, is about a weekly cadence. And as I stated before, any solution needs to be able to set up the payer to identify errors before they occur. And on the next slide, as we're looking at and working with our payers and helping them to choose a data source to fund their COB operations, we're suggesting that they look at things like what data is being used. Is the data coming from a direct payer source? Is it coming from the source of record of the enrollment of the member? Or is it coming through some sort of third-party redacted database source that is not maintained as well as a core source system? How current is the data? Is it real time? Is it coming from a repository? How often is it updated? How does the data interface with the back-end system, especially the system that's going to pay the claim? How easy is the data to use? Can it be brought in and can it be easily integrated into the payer system? How beneficial is the data in managing provider and payer operations? And how easy how impactful is it to the member to make sure that they can be taken out of the middle of the claims adjudication experience? And how costly is the data to acquire? So some of the things that we think are reasonable for the payer to consider when they're looking at a source. Also, what is the coverage of the source? So on this next slide, we have some information that we track about our work in COB operations. When we look at our reach into the national landscape, you can see that we have some impact in all 50 states, with the darker shaded territories more heavily penetrated, and by that I mean commercial members whose data is included in our COB solution. And when we look at this, we think that this penetration is driven by a number of things. Full participation of large national carriers, first of all. Continued adoption by state and regional payers, and we continue to build out and darken the shading over into the western part of the country. We have some implementations that are forthcoming of members into our solution over the next 2 to 3 months that will darken this map even more. A large-scale adoption by Blue Cross and Blue Shield licensee plans, and as I mentioned, a recent concentration of adoption activity in Midwest and Western states. So this is something that we continue to look at on a regular basis. A good solution also needs to consider how is the data accessed. And so on this next slide, I want to talk a little bit about the system that I've described to you is a reporting system a database that delivers weekly files or weekly consistent reporting of information. But we understand that COB information is useful and necessary for folks across the payer enterprise. So recognizing that not everyone is going to have access to that flat database of information that can come in every week, we've made some investments in making the COB data visible through a portal solution. And that portal provides easy access to staff across the payer enterprise by reviewing and using shared COB data. And the top features of the portal today include the ability for an individual, and this may be someone who's processing a claim, someone who's setting up a membership record, someone from the actuarial department who needs COB information, to quickly look up COB records and COB record history for members who are contained in the database. A data overrides feature, which allows individuals within the plan to add to and supplement COB information. So if for some reason we have a record that's been input with a data error, an incorrect date of birth, a incorrect business model, we can add to that COB data and share that information to the payers who are involved in the overlap with that particular member. A workflow tool, which was recently added to our solution, which links all participating health plans in managing shared COB membership. So if we have an overlap that's in our database, excuse me, both of the payers who are having ownership of that member and who are enrolling that member can see the overlap, share information, trade documentation, and make free text notes into the overlap in the database so that that patient can be managed in terms of their coordination processes. And the last thing that we think is important is using our communication tool to set up and promote and communicate who are the subject matter experts within each participating health plan. So if you have a member who has a Medicaid coverage, who is the Medicaid expert in the payer that you're looking to coordinate with and communicate with? So rather than going through a customer service process of trying to find the right individual, you can find the exact person that can help you manage your member in conjunction with their other coverage health plan. So on the next slide, I'll speak specifically about our COB Smart tool. And our solution is called COB Smart. It is a large national database that health plans voluntarily contribute membership to on a weekly basis. We match members who are in the database, who belong to multiple health plans, and then determine which of those plans is primarily liable to pay the claim. And then this data is securely reported back to the health plan in a flat file format using secure transit methods, and also available to the provider or to the payer in the portal presentment that we just discussed. And then payers have the opportunity to help pass this information back to the provider through concatenating the COB information into the HIPAA 271 response that they send back to their providers when that provider is checking eligibility and benefits for their member. So again, looking to share data, have a collaborative approach where we have payers coming together through a neutral party to share information, and trying to get that information ultimately back to the provider as quickly as possible so that they know to whom the claim needs to be sent in what order. Now, we know that with Medicaid plans, coordination of benefits can have some unique drivers. Obviously, all COB data is volatile and prone to change over time. But we know that Medicaid data can actually be more dynamic as members move in and out of coverage, unlike in commercial coverages, which tend to have an annualized policy period. COB Smart actually provides a weekly insight into the volatility and movability of the data. And one of the things that we've actually noticed also is that when we started working on COB Smart 7 years ago, we didn't think that there would be that much opportunity for Medicaid plans to overlap to commercial coverage, but we've been more than surprised when we've seen more than the expected amount of overlaps between commercial and Medicaid coverages that are revealed through our weekly reporting process. And so that means that in terms of health plans, Medicaid plans actually have the easiest path to absorb the data through COB Smart finalize it for research resolution and loading to the back-end system so that claims can be paid in the right sequence. So I'm going to stop at this point, and I'm going to turn it over to my colleague, Tiffany, and I'm asked her to talk a little bit about her experience at United Healthcare of applying these best practices and these solution approaches to COB. And then we'll come back and sum up, and then we'll have some questions from the audience.
All right. Hello, everyone. I'm Tiffany Cease from United Healthcare, and I just want to provide a little bit of a high level of how we run our COB processes today. And I don't know if you need to flip to the next slide. There it goes. A little slow. All right. So high level, this is how we handle our COB processes. So we do process the weekly file. As soon as that file comes in, we're triggering our processes that same day, well, literally within hours. We do apply some internal business rules. And so really with our internal business rules, we're looking to focus on the right membership, make sure we're looking at the right kind of membership within that data file. We do auto-load a subset of our population on that response file, and really what we're targeting there is where CAQH has that determined primacy. We do know UHC is that secondary payer in that situation. We do also have a subset that we perform a manual investigation on. So if maybe the primacy hasn't been determined, or we think there could be some type of indication of a family dynamic situation that requires that extra level of review, we do have those complete a manual investigation. We also perform as our next step a data validation. We do that either manually through a phone call if that record is being manually investigated, or we may leverage a data clearinghouse. Then the COB flag is set in our system, and then the claims can see and process against that COB information, and that results in our COB savings. In addition to the weekly response file, the Cob Smart Portal is leveraged by quite a variety of our internal teams. Our COB operations folks who deal with COB every day, our claim operations folks also leverage it. So if we have a claim coming in with an EOB, we want to make sure that coverage is truly accurate and that primacy is accurate as well, so we can make sure we're paying that claim correctly. Our prepay and high dollar audit operations team also leverages the Cob Smart Portal because we are a very big company. So we do get a lot of COB information. So you may have a member who has never had a claim, they get super sick, and all of a sudden you have $1 million claim. We leverage the Cob Smart Portal to just do a quick check to see, does this member have some type of other coverage? Because you really want to know that information before you're paying out those high dollar claims, because there's a lot of high focus on that. And it's also leveraged by our recovery operations team. So if they're maybe getting some type of unsolicited check, as we call it, some refund in the door, they can make sure and determine who's the primary payer and what that coverage overlap is. So one of the great pieces that CAQH has deployed this year is the data validation process. And for us, we've seen a lot of benefits that this process has, since this process is deployed, it has really helped increase our value of our COB program. So we've been able to increase the auto loads of our flags by 10 to 20%, which is really great because anytime you can auto load a flag, you don't have to have someone manually working it and spending those SG&A resources. We've also seen increased prospective savings by 5%, and that's really by identifying the flag sooner. So if we can auto-load a flag, that flag is loaded day one instead of if it was had to be manually worked, that may take 3 days, 4 days, 5 days, 7 days sometimes, if you can't get a hold of the right information. So we are setting those flags sooner, which is getting us increased savings. We've also seen reduced costs that we were having to spend on validating the other insurance information. And we were doing that through clearinghouses and manual phone calls. So the fact that this data is coming in already validated, these overlaps from CAQH, that completely removes that step in our process. And we've also seen increased productivity even within our operations team on the stuff they do have to manually investigate, because they don't have to go check and say, is this coverage still active? Is this information valid? All that information is just right there. It's already been verified, and we can make that correct primacy determination without having to perform those extra steps. And we did perform an internal quality audit of the validated records that we received from CAQH, and the accuracy was really great. We saw over 99.5% accuracy, and the few, like 1-2 errors we saw was timing. It was updated maybe the day before or the 2 days before. So really, really great results. Very pleased with what we're seeing with the data validation so far. With United Healthcare, we have participated in COB Smart since the very beginning. And we've really focused on ongoing data management activities to really improve the quality of the data that we are providing into CAQH and ensure we have very good data integrity. This has helped us out, actually resulted in increased savings for ourselves and also making sure that the other payers have a good experience with United Healthcare's data. So there's some great reports that CAQH provides. The missing records report, we've the group migrations, data overrides. Those are some really great features within COB Smart that helps you maintain your data integrity. We've also focused on internally what we are sending in, ensuring we have the right business models. And you know, you don't want to say someone's a Medicaid member if they're a Medicare Advantage member. So we wanted to make sure we had really good, accurate data going in. With missing records, CAQH, like I said, they provide those missing record report. We were able to identify an issue we had internally where previously we were seeing over 77% of our UHC records going missing on the subsequent submission files to CAQH. After our improvement activities, we were able to get that missing record volume down below 0.5%. And for us, COB Smart provides us a tremendous amount of value, and we really see it in those 4 key areas. We are seeing increased medical cost savings, and that's when we're paying the claim accurately as a secondary payer that first time that claim is in the door. We're seeing reduced claim rework, and that's really, I mean, we're making sure we're processing the claim correctly the first time, not having to spend those resources down the road to go rework that claim. We're also seeing reduced vendor fees. So internally, if we identify the COB, we can do that at a lot lower cost than if we have to leverage an external vendor to do that identification and then the associated commission fees for that identification. And really the biggest piece is we've improved the member and provider experience. You know, the NPS for our members, it's helped us see a reduced phone calls, we're accurately paying the claims, but the experience for the member and provider is a lot more improved if you really get COB set prospectively and don't have all that back and forth. COB Smart provides us a really good ROI, which is return on investment. So if we look at our commercial membership, our ROI is an 80-to-1. For our Medicaid business, it's a 75-to-1. And for our Medicare Advantage business, we see a 48-to-1 ROI. And COB Smart has absolutely the highest ROI out of all of our COB processes.
Thanks, Tiffany. I appreciate those comments, and hopefully we can hear more from you in just a second when we open up the presentation to questions from the audience. I just wanted to wrap up here by talking about some of the things that CAQH is proud of in terms of the approach that we've taken, the Prospective approach that we've taken to develop best practices for managing COB. So on this next slide, just wanted to point out that, you know, over the last 7 years, we feel like we've had a significant impact on the industry and on the payer, the provider, and the member patient level. We've assisted health plans in identifying overpaid claims amounts, which leads to the potential to recover those overpaid claims amounts. We provided health plans with more primary source information that allows them to reevaluate and realign their use of third-party vendors. We've assisted health plans in paying claims more correctly, more accurately, and more timely because that good information coming primary from the source on a weekly basis is available for loading into the health plans back-end systems. We've assisted health plans in reducing the cost of doing business by changing staff allocation for COB operational tasks, increasing the total data opportunity for COB operations, and streamlining the process that leads to correct member load and membership data into the back-end system. And ultimately, the health plans, providers, and members benefit from having their claims settled more efficiently and more correctly. So we're hoping that today what we've been able to show you and what we can continue to discuss with you on this next slide are some key takeaways. The opportunity to reduce administrative costs, and especially because the cost of using this alternative database or this alternative solution has a very high return on investment for the organization. That there's a focus on not only administrative costs but also medical costs. So having claims paid correctly ensures that the medical loss ratio for the health plan is calculated accurately. Insight into data, insight into trends previously perhaps not known. You know, when you're looking at data from other payers, you can develop over time a sense of trustworthiness of the other payer's data, an insight into the collaborative capability of other payers with whom you're working in your markets. Developing relationships. I've heard Tiffany talk about the fact that, you know, she will have a case sometimes and she knows exactly who to pick up in the other payer and easily resolve that case, and vice versa. She's available to folks in other health plans to communicate about their shared members. And then, you know, having a improved provider and member experience, again, primarily through the accurate execution of tasks committed to in your contracts with your providers and on behalf of your members. So at this point, I'm going to turn it back over to Randy, and I think we will have a chance to respond to some questions from the audience, and we'll look forward to that opportunity.
Thank you so much, Morgan, and thank you also, Tiffany, for all that great information. We do have a few questions for you. The first is for both of you to address. So in a COVID-19 world, what do you think is the most important element in payment integrity that can deliver value for health plans?
I'm happy to take that one. So for us, with COVID-19, much of the recovery activities have been very limited or restricted. So from a COB perspective, this puts even greater emphasis on identifying that COB proactively so that claim can be adjudicated and processed correctly the first time it's received. Because if you catch it after the fact, if you're doing it all retro, you won't be able to get the same savings opportunity because in today's landscape with COVID, and we really don't know how long this is going to go. So COVID could go the end of this year, maybe end of next year. I don't know. We all want it to end tomorrow, but that's why it's for us super important doing stuff proactively because we can't do as much from a recovery perspective.
Okay. Yeah,
I totally agree with that perspective, and to me, you know, having a solution that sort of helps manage both ends of the continuum. Certainly understanding what your errors are that have been committed in past, but allowing to very easily pivot back to your opportunities for prevention. And especially having a data source that attaches to, you know, now we have 42 payers who are participating in the solution. And so you're basically able to, as members move in and out of coverage, as they lose jobs, get new jobs, as they move from private to public coverage, showing that movability on a weekly basis and catching where those members are changing condition, and having that longitudinal record of the member certainly lends itself to that payment integrity mindset for the organization.
great. Thank you. Thank you. Let's see. This next question is for Tiffany. Now, are you tracking any specific metrics? And if so, can you share what and how you determine value?
Yep, So internally, we do track several different metrics that help us quantify the value of the COB Smart and how much it provides. We track our medical cost savings, and this is quantified by looking at the difference between what we would have paid as the primary payer and what we paid as the secondary payer. So your delta there is your medical cost savings, and we track that every single month and on a yearly basis as well. We also track our return on investment, ROI, and we quantify this by looking at the cost of the COB Smart program compared to the total medical cost savings.
Okay, yeah, that's great. I mean, that ROI is so important, especially in the Medicaid world. Just thinking about some of the budget constraints that Medicaid programs are facing. So anytime that it's possible to save money in that arena, I think that's super important. So thanks for sharing that. Morgan, here's a question that's come in for you. How do I find out what percentage of members in my service area are using COB Smart?
Great question. We can customize a report for you. And I think on one of the next slides, you're going to see my mug and my information. And you can definitely contact me after the presentation. I'll have one of our business development professionals discuss your service area with you, talk about our operation in those areas and what the potential for COB Smart to impact your workflow there would be.
Okay, great. That's wonderful. And yes, just so everyone knows, we will be sharing contact information for our presenters today. So another question that's come in, and I think, yeah, this is probably more for Tiffany. With the implementation of COB Smart, did you have a reduction of COB staff? And if so, what was the percentage of that reduction?
Yes, we did. So when we first implemented, again, this was a while ago, but we were able to see a 10 and 15% reduction in kind of that staffing that was required. And really, that's because they weren't having to do so much of the manual processes. They had one source they could go to find an indication of overlap. We also had the ability to auto load. So that's really where that freeing up of the SG&A resources came from, and we experienced roughly 10 to 15% reduction at the very beginning. Unfortunately, no one tracked it like kind of year over year. I expect it has increased since then, but right at the initial, the first 2 years of implementation, we saw 10, 15%.
Okay, great. Thanks for sharing that. Let's see, another question. I think this one, Morgan, is for you. So Tiffany in her talk mentioned a data validation process that really helped the auto load process. Can you elaborate a little more on that, how that works?
Sure. One of the missions of CAQH in our core area that Randy mentioned at the beginning of the broadcast is work on promoting the use of standard transactions across the industry for claims and eligibility and benefits processes. And so we think that the best way for us to, once we have gathered the information from payers, identified a potential overlap based off the information provided, and to replace that manual phone call that may be happening in some instances when we report an overlap to a payer, but that payer wants to confirm that that overlap is still quote unquote good or active before they load it to their system, is to use that TIPA 270, 271 inquiry and response transaction to confirm the current active coverage status of that overlap. So early on in the presentation, the slide that has the 5 dots on it, if you'll go back when you get your materials for the call today and look at that workflow, what we're doing is after we have identified and we're preparing the reporting of the overlap, we're actually going back to payers who agree to this validation process, And right now, I would say that more than 60% of the membership that's in the COB Smart database by payer is participating in this validation protocol. And what happens is that we send a 270 to the payer saying, okay, you told us this member is your member. Could we confirm that on this date of service that this member is still active? And so what we're able to do is not only communicate an overlap that's been found in the database to the payers, but to confirm with them that both of the payers have rendered that member still active. So again, a method of prioritization in that weekly reporting, because we're talking about, at different times of the year, we're reporting hundreds, if not thousands, of overlaps on a weekly basis with new and changed overlaps in the population to the payers. So that allows those that have been prioritized as active to be loaded first, and for those that are determined inactive to be researched to see what portion of the overlap was valid and what portion of that overlapping coverage period should be loaded to the backend system for reclamation purposes. So, what we've done is really to try to look at the workflow that traditionally has existed within health plans and that manual verification process, look for ways to automate that using those nationally approved and endorsed standard transactions.
Okay, great. Yeah, thank you. That's like super helpful. Another question, maybe for either of you, but I think probably Morgan. So how are divorce, custody, primacy determinations handled or determined where NSP guidelines have to be applied? Morgan, I know you and I have talked a lot about this.
So what we have coded our logic to is a set of primacy determination rules that are incorporated in our database. They are driven by NAIC standard rules. And when we are able to apply an NAIC rule to determine a primacy status, we will deliver the primacy determination of we determined the primacy, and we will point to the rule set that we use to determine the primacy. And alternatively, if there's some reason why we cannot determine primacy, and sometimes there are things about the data that render us unable to be able to render a primacy decision, we will send back in the weekly reporting the undetermined primacy status and the reason why we were not able to determine primacy. And part of what we do from a product perspective is we're consistently looking at primacy determination and looking for ways that we can increase the amount of primacy rules that we can apply, and also monitoring any challenges to the primacy determinations that we've made. And I can tell you that from a matching perspective, we are able to be accurate at a 99.9999999% level in the matching that we do of members amongst payers who are in the database. And we have equally small a number of challenges to our overlapping decisions. That's probably based on the fact that we take relatively a conservative approach in applying the primacy decisions. When we're not able to determine primacy, generally it's because we find that there may be more than 2 instances of a member in the database, whether because that member actually does have tertiary coverage, or that there may be overlapping records that are duplicates from a particular payer. And so we can't determine primacy in tertiary situations yet. Our focus has been on deduplicating the database through some data rules to look for those duplicate members, and manage the accurate loading of the members in the COB database. That validation approach is very important to us, because if we're finding that a terminated member in the payer data set has not made it over to our database, through that validation process, we can easily identify that, get that member terminated, not have tertiary instances, and apply the primacy rules. So.
Okay, great, thank you. All right, so we got a couple more, and please, everyone, keep the questions coming. We've got a few minutes left, and I think we can get to all the questions, but if you have other questions, don't hesitate to throw them in the question box. Okay, so this one is asking about the provider experience, and has there been any feedback coming from the provider community about the COB process, COB Smart process?
I think Tiffany and I can possibly both answer to that. I know that we've been doing this for 7 years now, and so CAQH has a recognition value amongst providers primarily through our provider data solutions. The majority of providers in the country maintain their credentialing with their health plan through our CAQH ProView tool. And so we've seen almost an equivalent recognition of COB Smart as a source of data around coordination of benefits. The visibility of the information to the provider generally comes through the payer. Again, as I mentioned, in the process of taking the COB information, concatenating it into the 271 response that goes back out to their provider when they're inquiring on eligibility and benefits. And so communicating to that provider, hey, this is where we, this is what we found, this is what we know to be the information on this member. They may have other coverage. You might want to pursue this other coverage and confirm this with your member. That happens primarily from the payer to their provider. Now we do have, and we have pursued some partnerships with national clearinghouses who, at the permission of our participating health plans, can actually inquire to the COB database about inquiries they're executing on behalf of their payers. So if a payer is inquiring on a member who belongs to Care First Blue Cross Blue Shield, for example, Care First participates in COB Smart, that clearinghouse has the capability to come over to the COB database and pull just that COB data and concatenate it into the 271 response going back to the provider through the clearinghouse. Now, we haven't had a lot of traction on that program, but our preference is for the information to be transferred from the payer directly to the provider. But there certainly is a growing impact, and certainly one of our chief objectives is to get that information to the provider so they can bill that claim using the right information, as opposed to the payer intercepting it and correcting it based off the COB program information.
Okay.
Right. And I can add in a little, I add in a little bit. So we do measure NPS, Net Promoter Score, for our providers. And, kind of historically, I'd say COB has always been a challenge because we didn't really have as robust of a prospective program. We got there with COB Smart. And so the providers like when we set the flag correctly before the claim is processed, because they really don't like, getting a refund or a refund request from us because we overpaid them. They've got to go chase down the other provider. So we've really focused on making sure we set those flags, COB information prospectively, so that way, when the provider, before they even submit the claim, they can come to our provider portal, check that member's coverage, check and see if they have COB, so then they know who they need to bill that claim to as a primary payer, and instead of having to get, an overpayment letter and having to send money back in and just having a messy process.
Okay, all right, great. Let's see, I think we've got one more question here. So, and I think for, actually, no, we've got two more questions. Sorry, let's see. This one for Tiffany. Do you have a message for payers that are considering the data validation process to be able to auto load data into their system, that aren't sure if they should move forward with it?
Sure, yes. So with the data validation process, before data validation, we'd get even if we were going to auto load a record, we'd still have that kind of second check that we go through a different clearinghouse to validate the data. By already getting that in with the CAQH information, we can just go straight to an auto load. The price is cheaper through CAQH than what we were paying through a third-party clearinghouse like a lot cheaper, which is really great. I mean, we all live in a money world where we're trying to maximize our profits or reduce our costs. So that's been really helpful because we don't have to do that kind of second step verification. It's already been validated with CAQH. That overlap's good. We can hone in right on those, determine primacy codes. We're the secondary payer, and just go straight to auto loading in our system. And we even do a quality audit of our auto loads every single month to make sure we're still at the appropriate quality level, above 99% on everything, 99.5% on everything we're auto loading. And even with the validation process, we're still right there. We're great. We're still above our mark every single month with our continuous audits we do on our auto loads. So from a price perspective, it's cheaper from what we've seen. Process perspective, it's a slam dunk because you don't have to have so many manual resources, and you can set the flag sooner, so you get even more increased auto load savings. Medical cost savings.
Okay, great. Thank you. And let's see, we've got a minute left. I think we've got one final question that's come in, and this one to Morgan. So as you're thinking about, I guess sort of the future of COB Smart, what are there new product features that you see coming down the pike that can be helpful, particularly as we're facing some really challenging issues throughout the healthcare system, and particularly in Medicaid? So just looking at what's new and how are there any improvements coming for COB Smart?
That's a great question. And if anybody ever wants to spend about 10 hours talking about COB development, I'm your man, because we've got a whole bag of ideas and a backlog of work that we want to do. But I can tell you that our focus for 2021 is going to be on differential use cases for COB. We feel like, our solution is primarily focused on medical coverage overlaps, although we do collect information on what we call specialty COB: vision, dental, behavioral health, and pharmacy. And so in 2021, we're going to begin actually reporting on the specialty COB areas a little bit differently. Today, we give out information to a customer with a medical member who we see has a specialty coverage through another payer. And that's just a breadcrumb for that plan to say, oh, there may be some other pharmacy coverage. I might need to go investigate this. Over the last couple of years, we've heard our customers say that pharmacy is sort of a wash for them from a COB perspective, to now they're saying we have to have a dedicated COB program for pharmacy. And so next year, we're working on a pharmacy to pharmacy reporting module. From a Medicaid perspective, we've heard that behavioral health, because that is required coverage for Medicaid providers, having some type of an idea about behavioral health to behavioral health coverage is an opportunity for us to investigate. We're looking at taking the validation activity as it exists today within the database to perhaps expanding that to some type of an on-demand validation process, especially because the COB portal allows us to workflow overlaps and research as a part of claims adjudication or high dollar claims adjudication. We'd like to make it easier for the payer to confirm that the overlap is still in place before a particular claims payment decision is made. So yes, we've got lots of ways that we want to go, but we're looking to make what we have better and easier to use and more systems integrated, but also to expand the impact on COB across non-medical coverage.
Okay, great. Well, that I think that wraps us up. We are at a couple minutes after 2. Could we flash the next slide that has the presenter's contact information? Thank you so much. So for all of you all still on the webinar, thank you again for joining us today. Please do feel free to reach out to Morgan Tackett and Tiffany Sees if you have follow-up questions. Again, we'll remind you that you will be receiving a copy of this webinar recording And again, just thank you for being a part of it today. Thank you again to the Florida Association of Health Plans, to Morgan and Tiffany, our presenters, and to the CAQH team. And it looks like, a reminder too, we'll also be sending out questions and answers to all of the attendees. So you'll get a whole lot of information to follow up on this webinar. Thank you all again and have a wonderful afternoon.